Hello, my name is Bill Young. I'm immediate past president of the Endocrine Society. Today, I'd like to tell you about the Endocrine Society Ambassador Exchange Program. This program is where an endocrinologist and trainee from a U.S.-based center travels to an international center where resources are limited and indigent populations are served. This is for a 2-week period of time. Then, an endocrinologist and trainee from the international center travels to the U.S. center for a similar 2-week period of time to observe how endocrinology is practiced in the United States. And now, I would like to introduce you to the Endo Ambassadors.
My name is Gary Hammer from the University of Michigan. I participated in the ambassador program to Mumbai, India, to KEM Hospital. For me, what I gained professionally most profoundly was a deep respect for the importance of cultural differences in clinical care, education, and research.
Okay, I'm Tobias Elsa. I'm the fellow from Michigan, took part in the Endocrine Society Ambassador Exchange Program to Mumbai, India. And it was overall a very great experience, and I certainly learned a lot about the culture in India, as well as what I would particularly like to mention, a different educational culture.
Hello there, I'm Nalini Shah from India. I represent King Edward Memorial Hospital from Mumbai, which is a university teaching hospital. And my department was privileged that myself and my trainee, Dr. Shruti, were chosen to participate in Ambassador Exchange Program. I think professionally this was greatly rewarding that we could and we will be able to bring back a lot of variation in our own practice back home, which will be meaningful for our patient care, training, and our collaborative research.
I am Dr. Shruti Khare from KEM Hospital, Mumbai, India, and I consider myself very lucky to be part of this program, which allowed me to observe the healthcare delivery system in University of Michigan at such an early stage of my career.
For me, what I found most profound was the kindness of the people in Mumbai, despite an enormous population together with profound poverty. People seemed genuinely happy and interested in helping each other.
The most important experience during this exchange program were certainly the individual interactions with the fellows and doctors who I would say after this exchange have become friends of ours. And I would have to say that I certainly learned a lot and felt at home with their enthusiasm and dedication to academic medicine.
To my mind, I think personally the most rewarding part of the exchange was meeting up with so many experts in the field of endocrinology and the related aspects, and I think Ann Arbor is a beautiful town that I've ever seen.
For the first time, I had traveled to some place which was outside India, and Ann Arbor was a perfect place where I thought that it is close to the nature as well as it is so well developed from all aspects, and finding a place with the two things which are coexisting, I would not have thought about that.
I think one of the most profound experiences that I had in Mumbai was during a clinic experience with a patient and her mother. And the patient was non-compliant on her thyroid medication. And after a brief while, I was educated beyond compare about the different cultural issues at play with medical compliance and taking medication. The young woman did not want her husband-to-be to know that she was hypothyroid, because she would not be considered an appropriate wife in the process of finding a husband. Her mother then spoke up and with tears in her eyes showed me the profound vitiligo under her collar and proudly commented that she showed her husband that before she was married and that she would never hide her daughter's truth from another human being. And in that moment, we shared a special moment of truth in healthcare and in relationship.
I think what was most rewarding during the trip to India was actually the hospitality by our Indian hosts, which really was very remarkable, and they embraced us with all their culture and kindness.
To my mind, I think the most rewarding thing about our visit to Michigan is the sheer emphasis and the sort of zest for research that the whole team at Michigan has. And this research is driven by a clinical question and goes back for betterment of patient care. And I thought that was truly remarkable.
I think I was impressed by the multidisciplinary clinics which are there in University of Michigan, and I feel that we have few of the components, like we have endocrine surgeon, we have pituitary expert, but they are not sitting together, and there are few components which we don't have but which still can be recruited, like geneticist or genetic counselor is lacking in our setup, and few components like nurse practitioners are already there, but their role can be bit modified and they can be more specialized. So multidisciplinary clinic is something which can still be implemented in our setup, I feel.
I would like to take back a more deepened appreciation of the cultural differences in our patients.
So in terms of applicability of our experience, I would like to say two things. One is certainly that I think it sharpened my understanding for cultural differences. The other thing I would like to mention is really that it also opens your eyes towards your own limitations in the healthcare and research system we work in. And I think that recognizing these limitations will help us greatly in the future to overcome certain barriers, which can be especially reached with collaborating with our friends in India.
I think what I'd like to take back with me is way forwards to optimize care of our patients back home, and especially the healthcare delivery system, by putting together the multidisciplinary clinics and hopefully having a bigger role of a nurse specialist being achieved.
One more thing which I was impressed was with that when the thyroid FNAC was carried out by the endocrinologist, it was simultaneously the slides were reviewed by pathologists, and this saved one more visit of the patient, because immediately whether the sample was adequate, that could be commented on, and at least a provisional report could be generated right away. So I was very much impressed with that fact, and I think it is feasible in our setup also.
What I hope to take back to our clinical care is the fact that more is not always better. With a paucity of resources, the clinical acumen and care of patients that we saw in Mumbai was simply remarkable. If I think about our time in India and your time in the United States, I think we all would agree we learned a great deal about how the different educational systems both are beneficial and have different strengths. I think the ability to move this relationship forward and expand it into collaborative projects, fellow exchanges, are all on the table of possibility.
Certainly, I think this is just the beginning of a great new relationship, and I would consider this to be just a stepping stone towards ongoing faculty exchange program and even fellows exchange program, and I think that will build up the relationship over a period of time, and I truly look forward to that.
Yeah, I would agree, and I think that the travel to India and actually the ambassador exchange program very much helped in all aspects it's the fellowship program, education. I think we're right now in the process of actually already crystallizing some kind of future research projects. And I think it's also, especially for fellows, very, very valuable to see the different kinds of patient presentation you have in India. Like I remember the patient with a primary hyperparathyroidism, which is a textbook presentation, which we don't see in this country really. So I think this is a great experience for both sides.
Yeah, it'll be great. I think we can just sort of lay open the textbook of endocrinology for your fellows, and I think they'll be thrilled and they'll truly enjoy it.
And I also feel that few of the faculty members from University of Michigan have already agreed upon that they will be visiting our institute, and we have got though preliminary the thoughts about future collaboration in terms of some genetic assistance for disorders like premature ovarian failure, hypogonadotropic hypogonadism. Such research projects can be collaboratively set together.
So, to me, that really illustrates what we've been saying all along, that the Ambassador Program is really just a catalyst for a long-standing relationship across the whole spectrum, really, of clinical care, research, and these exchanges.
Very true. And it was remarkable the way in which I think your healthcare system is set up in a paperless manner. The radiology was being accessed from every port, the histopathology was being accessed from every port, and you were truly working without a patient chart. I thought that was something, to an extent, we need to learn and imbibe as well. It was truly rewarding to see that.
Although I would actually really add one thing which really was striking for me in India when I was with Shruti on inpatient rounds, that your patients all carry their own charts. And this is the chart they take home. That's the chart they take to their primary care physician. And of course, working in a different country, different health system, I asked, how often do your patients actually forget to bring these to an appointment? And the answer was never. And I think it tells you something about the appreciation of healthcare in your country as well.
Right.
I will strongly recommend other participants to avail of this opportunity and knowing the healthcare delivery system across the globe.
My clear advice for this is don't think twice, go.
Dive deep, jump full in, and engage yourself deeply in the tripartite missions that most of us engage in: research, clinical care, and education.
I would go all out for it. It's such a great experience. Just go for it is my advice.
One thing I'm thinking of is that sometimes in our health system we do things because we can. And in Mumbai, it was very evidence-based, doing things because you need to, that will help the care of your patient.
I would very much agree with that we do things because we can, but we also do things because the patient requests this, or the patient demands this, which is very different in India, where I felt that truly the disease and the restoration of health was very much in the foreground of healthcare.
I think the truly remarkable difference to me was the patients are extraordinarily well informed about their problems, their disease, and the status of their management. And they were also very demanding of good health care. So the respect for patient privacy was also enormous. And I think these were the two major differences to my mind that I observed.
I think the endocrine subspecialty, which is widely prevalent here, which allows more focused and research-oriented approach to the patient care. And then the ratio of healthcare provided to patient was also much better as compared to our setup. So the number of hours or number of minutes spent per patient are also much more.
With all the differences and all the similarities we had, I think the most profound one is that endocrinology is what brings us together.
For more information on the Endocrine Society Ambassador Exchange Program, please visit the Endocrine Society website.